Hi, my name is Lauren and I have Graves' disease. So Graves' disease is an autoimmune disease and it's also known as hyperthyroidism. So it means that my thyroid gland is overactive. It works more than it should be. So your thyroid gland is a small organ based at the bottom of your neck. It's sort of like a butterfly-shaped organ. That's how it's described. It's sort of like I've seen people describe it as like the size of a plum, but like chopped in half. So you have like two sides of the organ. Your thyroid gland controls things like your metabolism, your temperature, and how fast your heart rate should go. And obviously other things as well, but that's the main bits. With mine being overactive, it can cause things like heart palpitations, hand tremors. My body's not that great at controlling its temperature, and my body just works too fast and my metabolism is too quick. So I lose a lot of weight. So I was diagnosed back in 2017 and it is now 2022. So I have been on and off with this thing for about 5 years. So when I was diagnosed in 2017, I was extremely thin. I was 7 stone at the time, which is tiny for an 18-year-old woman, and I'm about 5'6", I think. I'm around there. So that's like very underweight for my height and my age, so it wasn't good whatsoever. But now luckily I am 56 kilograms, so I've clearly put on weight over the past few years, which is great, and I'm happy. I didn't feel very well. I felt like I was going through a bit of a depression phase. It wasn't great, and I just didn't feel myself. I just decided to go to the doctor and just talk it out, and she straight away was like, yeah, we need to check your bloods and check everything. And then I found out I had Graves' disease, which is such a horrible name for it. Graves. It doesn't sound nice at all. But after I was diagnosed, I was put on medication called carbimazole, and I was on the highest dose for a few months and then gradually got down to the lowest dose after about a year. And then after a year and a half, I was took off the medication because sometimes with Graves' disease, you can be on medication for so long and then take off medication, and then usually your thyroid gland should level out and be back to the normal levels. However, mine did not. I honestly felt it straight away. Like, I would say about 2 weeks, 3 weeks after being off the medication, I could feel I wasn't right again. I could feel sort of like a lump in my throat when I swallowed, which is also like a symptom, because like it's down here, your thyroid, just above your collarbone, right here. So when you swallow, you could kind of feel it if it's swollen. So then I was back on medication, and then after another year or so, I was off the medication again, and then I relapsed again. So I've been on medication, off medication twice, and it's come back very aggressively. Not fun whatsoever. And after that, I was told it's best to take the next step. Like, the next step was either surgery or something called radioactive iodine therapy. Surgery, it would just take the whole thing out, get rid of it, and then I'll be on replacement medication for the rest of my life, because the thyroid's not there. It's not because the thyroid's not there. It's not producing the hormones that it usually should. So then I'll have to get on the right levels of a different medication as like a replacement for my thyroid. And then radioactive iodine therapy, you take like a small little pill, swallow it, and it sort of like gets rid of some of your thyroid, sort of like deadens it down. I'm not quite sure on that one. I don't fully know information on that one. After I was told to make my decision, we went into lockdown. COVID happened, so obviously nothing really went ahead with it. So I was kind of in like a standstill for the past 2 years. And then eventually we could go back to like appointments and so on. And I had my first appointment back in February, where I could talk to a surgeon about getting rid of it. So obviously there's risk to both surgery and radioactive iodine therapy. Such a long word. But I personally chose surgery because I think that's just something better for me. There will be like a scar, there may be complications, but I'm just ready to, honestly, I'm just ready to get rid of it. I decided to make this video because there are a lot of people out there who are potentially diagnosed with something like this. And me personally, when I was first diagnosed, I didn't even know what a thyroid gland was. I didn't even know where it was. I didn't know we had them. Like, I had no idea what it was, where it was, what it does. And obviously when you're first diagnosed with something you don't know, you clearly Google it, don't you? And you look it up on YouTube, which is exactly what I did. And I didn't find that much information. So I'm just trying to put more awareness out there so other people see it's not just them going through it. I have an appointment to see a surgeon. And when I got that appointment, I was like, you know what? I'm going to make this type of video. I'm going to start documenting what goes on if I get the surgery. I don't even know if I will. Maybe this is just a throwaway video. Right, I finished my hospital appointment and it went swimmingly. So they gave me booklets about the next step of what I need to decide. So it's either surgery or the radioactive iodine. And to be fair to them, I didn't know what I wanted. I thought I wanted surgery because when it was suggested to me the first time, I was like, yeah, let's just go for that, because when it was first spoken about, I was in a different situation. I was working around children. There's a lot of children in my family and I was around them pretty often. And now I'm not, which is fine. Now I'm not near kids, so maybe the radioactive treatment might be the one to go for. He said 80%, no, he said the success rate is 60% to 80% of it working. And obviously your surgery is 100%. So I don't know, I've got to go away and have another think about what I want and talk to my family about it, because I don't know. I was hoping to just go in there and then be like, yeah, sure, we'll give you surgery, because I don't want to decide. I'm sick of deciding. I know it's my life, but I can't be asked to decide. It's been about 3 weeks since I recorded the last bit. So basically what happened at that doctor's appointment, I went in thinking, yes, I want surgery. I want the surgery. It's what's best for me. That is my decision. And then when I got there, I don't know what happened. I think I was a bit overwhelmed because there was a surgeon, a nurse, and like a resident, you know, the trainee sort of people. And they were just all in the room staring at me, and I just felt a bit uncomfortable. I didn't feel the confidence to actually talk properly or talk about what I want, and so on and so forth. And they just kept questioning, like, why this, why that, why not that? And I was just a bit, oh. Anyway, basically, they told me to go away and 100% decide what I wanted, either surgery or radioactive iodine therapy. And I decided on surgery. Like, that is what I wanted to begin with. But it was like a whole new person that I saw. Every time I've gone to the hospital, I've seen a new person, and then I have to start it all over again. It's really frustrating because they want to go from the beginning again, even though it should all be on my medical records. So yeah, today's the 5th of March, and at the end of February, the beginning of this week, I finally called up the hospital and told them, hey, I decided I want to have surgery. So now everything is in their hands and I'm just waiting for a next appointment. I'm waiting to see what's going to happen next. Little update, I had a hospital appointment with my surgeon on the 27th of April. I was going to record then and there, but I got there a bit late, so I didn't want to make myself even later. So we just spoke about what we spoke about last time, because obviously last time I had to make my proper decision. He wanted like 100% finalised decision. So as you guys know, I finally chose surgery. I just believe that's the best thing for me. I've probably mentioned this in a past clip, but I personally don't want to go through radioactive iodine therapy and then it not work properly or it fail, and then it's just going back to the beginning. It's like taking one step forward to take 3 steps back, and I've been dealing with this for just too long. So I'm honestly ready to just get it chopped out and get it gone. So we spoke about that I now want surgery. And he's like, yeah, okay, fine, cool. He got me some papers to sign. He obviously spoke more about what would happen to me, what will happen after, and so on and so forth. So like, obviously the incision will be in my neck because that's where your thyroid is. It's like, obviously I'm not a doctor. Disclaimer, I am not a doctor, I'm not professional. But the 2 vocal cords here, I'm pretty sure like your thyroid gland is behind here somewhere, because I know the surgery will affect my voice for a while. That's what I've been told. Like I may like sound a bit raspy, a bit, sound like I'm a bit unwell because obviously they've been cut. Well, my vocal cords have not been cut because my neck will be cut and everything will be moved out of place and stuff. So there might be like a bit of bruising, a bit of nerve damage to it. But it shouldn't be long term, touch wood. So he just went through that with me, like I'm gonna wake up with like a tube in my neck after the surgery. I've got this medication to take. I can't remember the name of it. I will try remember it and put it on screen. But it's some sort of like disinfectant that I need to take with a drink. So I've got to have 3 drops 3 times a day for 10 days before my surgery to like disinfect it, I guess. I have to take a urine sample on the day of my surgery. I have to do a COVID test before my surgery. Obviously, because I'm female, they would also have to do a pregnancy test before my surgery, just in case. And also I will have a endoscopy. I think that's how I say it. I suck at saying these words. But I basically have to have a camera. I think he said up my nose and then down my throat, or just down my throat. I'm not quite sure. I have to have one of them before my surgery, like a few days or a few weeks before my surgery. So yeah, there's a lot going on, but I'm thankful that it's finally moving forward. The only thing I am quite like nervous about is the actual surgery, obviously, and also it's my first surgery ever. I've not had a surgery at all before. Yeah, I might be alone because of the COVID rules, which is understandable. So that's the only thing that has me quite like nervous, because I'm gonna wake up and there's gonna be no one there. But other than that, I can't wait. I cannot wait. I am absolutely sick of my thyroid. I just want it to get chopped out and for it to go, please. Thank you. I'm recording this video on the 11th of June, and on the 13th of June is my surgery. I'm extremely nervous and I'm really anxious and scared, but I'm also so excited and so happy it's going to happen. Like 2 days time, and I'll begin surgery. Ugh. So there are risks to the surgery. It will affect my voice for a bit because there's like some voice nerves on top of your thyroid, which they need to like move out the way or maneuver so they can get to the thyroid. So apparently I'm going to be just a bit hoarse for a bit, like I've just got a sore throat. Hopefully, touch wood, it will go away after a while. However, if it does not and it's permanent damage, I could be going to like a speech therapist, speech therapy. The worst thing that could happen is getting a tracheotomy, which is like a breathing tube in your neck. But that's very, very rare that it happens. I have a diagram here, and as you can see, this sort of bumpy bit, that is your thyroid. Right, this is where your collarbones are, so it's literally right at the base of your neck. And then you've got like these small little tubey things, that's sort of like your voice nerves right on top of it. So they kind of just like move them out the way to get to your thyroid. And then there's also things behind your thyroid called parathyroid glands, and they control things like your calcium and stuff. So they might be a little bit damaged, and then I'll just have to be on a calcium supplement for a little bit. So preparing for my surgery, I have to take something called Lugol's iodine. It was so hard to find. Honestly, if anybody out there has to take this medication as well, please find it as soon as you can, because I struggled finding it. I went to 5-6 different pharmacies around my area and none of them could have it, because apparently it seems to be sort of like an older prescribed medication and not a lot of people have it in circulation anymore. So it was very stressful trying to find it, and then eventually I got it from the hospital. I'll show you what it looks like. I'm not going to try not to show my details, but it's like in a bottle like this. It's quite dark. It's sort of like it's a yellowy colour when it goes in a drink. So I just dilute it in water, and then I just have like a small drink on the side, just to get rid of the taste. Now the taste isn't too bad. It does have like a chemical taste. It's a bit like a chlorine sort of taste. So it's not that great, but it's not as bad as I thought it was. And then yeah, I just have a small drink to just wash it down with, get rid of the taste. I have a nasal gel. I have to put this up my nose twice a day, 2 days before the surgery. So I started this today and it's okay. It's not that bad. I also have to have a body wash, and it washes my hair as well. It's just like a decontamination sort of thing. That's okay. I think it just gets rid of like a specific germ that's on your body, and I think they just want to get rid of it, like just in case. Obviously, no nails, no jewellery when I go. So that's upsetting because my nails, I always have them done and now they're naked. Ugh. So I have to take some clothes. They told me to bring a dressing gown, even though I probably wouldn't use it. It's really warm this week. Like a towel if I need it, toiletries if I need. Change of clothes in case I'm there overnight. I have been told that I'm only there for a day. I'm only there during the day. My surgery is in the morning, hopefully. My admission is at 7:30 in the morning. So fingers crossed I get my surgery done early. Pajamas if I need them. I'm only going to be wearing I'm just going to wear some leggings and just a black t-shirt when I go, because you just got to be comfy. I'm not going to dress normally. Just going to dress in nice chill clothes. I'm going to take a pair of shorts because it's going to be warm. Obviously entertainment items, so like my phone, earphones, book. After my surgery, my thyroid gland will be underactive because it's no longer there. So I'll be going from hyperthyroidism to hypothyroidism. So I'll be going from overactive, just too much, and then underactive, just not even existing. So that's why I have to be on medication afterwards. No matter which option I chose, surgery, radioactive iodine therapy, or just tablets for the rest of my life, no matter which one, I would most likely have to be on tablets for the rest of my life. So I chose surgery because I just want to get it done, get it over with. Before my surgery as well, I have to isolate for 3 days, and each day I have to do a COVID test just to make sure it's negative. As well as COVID, I'm not allowed any visitors or anyone with me, which does scare me a bit because it's my first surgery ever. I've never had like any anaesthetic or anything, so I am really anxious about it because I'm gonna have no one there with me. No one there with me to comfort me, you know? So I'm sure like the nurses and everything will be absolutely lovely, but it's nice just having, you know, someone there that you know and that knows how to make you feel better. But I'll be fine. I'll be okay, I'm sure. Recovery time is about 2 weeks, so I can't drive for the first week because obviously with the incision being quite low on your neck, when you're driving, sometimes you need to turn to like check your blind spot, and obviously with the cut being down here, you don't want to reopen it when you're moving and such, because obviously, you know, it's not very safe, and you need to make sure you can do like an emergency stop without injuring yourself, you know, with a seatbelt and everything. So I don't think I'll be able to drive for about a week. I've heard people are a bit lightheaded for like the week after, so maybe that's also a reason that you can't drive. In terms of my job, I do quite an active job. I carry some heavy stuff. I do a lot of walking, so I possibly won't be able to go back to work for a while. The next time I will update you will probably be after my surgery or a day or two after. I won't be able to talk very much. I might get tired of talking. That's also one of the effects of surgery. But yeah, I really hope this video could help someone going through this. Wish me luck.